My name is Marc Raab from the University of Heidelberg Medical Center and the Myeloma Center there. Whether BRAF and MEK inhibition in myeloma is successful in relapsed refractory myeloma especially, I think we answered this to quite some extent with our BIRMA trial that we presented at ASH. As you probably are aware of, that activating BRAF mutation V600E in multiple myeloma is a rare mutation, about 4 to 8% in the refractory setting of the disease. So nothing compared to melanoma, but still present. And so we designed a trial to use combined BRAF/MEK inhibition and sorafenib and binimetinib in this case, as it's also approved for melanoma. For patients with heavily pretreated multiple myeloma and who have the BRAF V600E mutation present in the majority of their myeloma cells, so more than 50% of the myeloma cells. And so what we found in this trial is that overall, more than 80% of the patients responded. They actually had at least a partial response. We had more than 50% of the patients who had at least a VGPR, so very good partial response, and a quarter of the patients who actually achieved a NCR or a CR, complete response. So it's highly effective to use this combination in the appropriate patients, meaning BRAF mutation in more than 50% of the plasma cells. And although we don't have the final data on the PFS and duration of response, I can share with you that we do see long-term responses, so 12 months and beyond. And this in a patient population who had a median of prior lines of therapy of 5, so heavily pretreated. And of course, the duration of response is quite heterogeneous. Some are responding for a few months. Some are responding, as I said, for a few years. But it's definitely worth a shot. And although it's not approved in myeloma yet, but since it's widely used in melanoma, it's certainly worth using in myeloma if you get reimbursement for that. With this, I thank you for your attention.